you, President Hart. It's my privilege this evening to present the Wilson School District reopening plan as it stands right now to our public community in our board meeting environment. So if you can move to the next slide, please. We have been on a path as a district team, inclusive of health professionals, teachers, nurses, parents, administrators, and other staff members over the course of the past 6 weeks to put our health and safety plan together for the board to consider this evening. The plan incorporates data from a survey we sent to families on June 22nd, as well as planning guides from numerous state and federal groups, including the PA Department of Education, the CDC, and the American Academy of Pediatrics. First and foremost, our plan is designed to be flexible and provides our district with an opportunity to adjust or shift at any time to meet the needs of our community, to meet the needs of our students, and to meet the needs of our staff. We are considering this plan to be extremely fluid. And as we sit here on July 20th, we understand that things are changing weekly and sometimes daily with direction that we get from the CDC, from the Pennsylvania Department of Health and the governor's office. So we do understand that there is a likelihood that we will be back in front of the board communicating potential modifications to this plan over the course of the next 4 to 6 weeks. But it's extremely important, I believe, that we get information out to our community so our community can start planning. We have developed a robust, flexible plan that is designed to meet the needs of families, regardless of if their intent is to send their children back to school full time, to send their students into a virtual environment. We have created those opportunities for our community members and for our students. This time, I'd like to turn the presentation over to Dr. Trickett to really go through some more specifics. We will be sharing responsibilities this evening. Dr. Stout will present the elementary components. Dr. Trickett will present the middle school and secondary components. Dr. Hoffert will present the overall subcommittee work and some of our guiding principles as we move forward with this plan. So thank you again for the opportunity to present this plan to you publicly.
Thank you, Dr. Faidley. Before I dive into the timeline overview, I just want to take the opportunity. I see we have about 130 of our community members, parents, students, and teachers on the call. And I want to preface the next 40 minutes here kind of through the lens of the need for this to be a collaborative effort, a true partnership. A lot of what we're going to talk through here is really our best current thinking based on all the expertise and insight we've received. But in order for this plan to be able to put into action, we're really asking for the support and help of our community to help in any areas outside of our school district to minimize the spread of COVID-19. And we're going to talk about some of those ways today on how we do that as a school district. And those ways could be applied to our everyday life as well. So the timeline of where we are today and kind of how we got here. If you remember, back when we closed our doors in March, there was a lot of uncertainty with regard to what the summer would look like, and I think a lot of a sense of hope with a lot of people that we would get back to normal as we started the new school year in August of this coming year here. And the governor took a step in that direction when he stated and told the local school districts across this Commonwealth that we can reopen as long as we have an approved health and safety plan. So we got that information in early June. And since that day, we have been working diligently trying to include as many representative groups throughout our community to develop a plan that we feel is appropriate, is in line with the safety recommendations that we received, and inclusive of a lot of different stakeholders' feedback. So that work began in mid-June. We decided pretty early on that we were going to have a structure of a task force, a larger task force, which again was representative of teachers and nurses and specialists, principals, community members, different staff members from across our organization, to start to unpack and dive deeply into what this health and safety plan is and the 4 tenets that made up the plan. From that task force meeting, it was determined that we would need to develop committees that would be facilitated by task force members, because this work was just so large that we needed to distribute out the leadership and the work that was going into the recommendations to implement the plan that you're going to see this evening. Part of that work is to gain feedback from our community, and we were very thankful to have over 4,000 people participate in a community and staff survey, which really helped guide our thinking about 3 weeks ago. Questions along the lines of, would you send your child back to school if we could meet the criteria set by the Department of Health and the CDC? Would you be interested in using transportation? As well as some feedback pieces on our virtual programming. So we've been using that data to drive and inform all the decisions and recommendations that we'll be presenting this evening. We engaged our leadership teams. We engaged our principals, our supervisors, worked with local superintendents, worked with superintendents from across the country to get an idea of what they were doing. However, on July 7th, on the bottom of the left side of our screen was one of the most important and impactful days that we had in our plan to date. And that's the date where we engaged in receiving feedback and guidance from local medical professionals, people who are experts in this space, people who research and stay current with the facts, the science behind this virus, how it spreads, and how we can support those people who become ill here in Berks County. Everything that we read from the Department of Health and the Centers for Disease Control states that we need to go back to our local medical groups. So again, I can't reinforce enough to the families that are on today and to our board members that we are very fortunate in this community to have a community made up of wonderful people from the variety of different backgrounds. And this is one of those times where we needed to rely on that community to guide us. And they gave us very specific feedback. They told us some things that we didn't know. They expanded our knowledge in some areas that we had read. And that work is all throughout our plan. We spoke with members from that team as recently as 3:00 this afternoon, as they continue to give us feedback based off of what they're seeing in the hospital, what they're reading about the local trends, and it just cannot overstate the value that they've added to our group. On July 15th, we had the opportunity to meet with a parent group that was representative of all of our different schools. And we were going in a slightly different direction, candidly, a day prior. And because of some of the feedback we received, and because of where things shifted across our region, we modified our recommendation. And we presented this to our parent group, our focus group, on July 15th. And they had the opportunity to give us feedback, to ask probing questions, and really, again, serve as a partner to guide the work that we're doing. Not so much a Q&A, but more of just a feedback loop for us as a team. We then had the opportunity to meet with our professional staff members on July 17th, and we presented the plan in its current state to them last Friday. All along, modifying, tweaking the plan that's on the board agenda this evening, which is the July 20th board date. And just a reminder that this plan is still tentative, it's very fluid, and we do expect to come back to our community and our board in the coming weeks with adjustments as this continues to change. There will be a communication going out to our community tomorrow, as well as our staff, informing them of this plan. And we're also recording this presentation, and we'll be posting this on the website for our entire community to have access to. Later this week, there will be a questionnaire where we'll be asking our parents to softly commit to what their plans are for next year. Again, I go back to the partnership. We need to know where parents are in their thinking, and there will be choice. That will help us build our schedules and help us maximize the staff that we have in our school buildings. Some of the overarching beliefs about our reopening plan, again, informed by our different community groups. We want to make sure that student and staff and community safety drives our decisions. We need to make sure that our plan is flexible and allows us to adapt as seamlessly as possible as conditions warrant, which is not easy. This is a novel virus. We don't have all of the facts, but we do know that our plan just needs to provide us with the flexibility to shift at a moment's notice. We know that no matter what happens throughout the year, that we need to be able to provide our students with a robust educational experience. And we know that that experience can't look the way it looked in March, April, and May. And we recognize that that was an emergency learning environment that we were in. And we're committed to making sure, to ensuring that the program is much stronger. And it's also our goal, as bolded there, to be in school as long as possible, which means that we need to take additional precautions early to allow that to occur, to give us a shot at being in school with our kids and our teachers as long as we as safely can be. So some specific factors that we were considering, or that we are considering. The current planning process is for all students to receive some form of face-to-face instruction. And we're going to talk about that as this presentation progresses. Determining factors that we're going to use throughout the year is really the virus transmission within our region, within our local zip codes, within our schools, and we're continually being in contact with our local medical professionals as they really are the people who are guiding us on the safety protocols. And that's, again, the key component is that constant and frequent communication. We also know that we need to maximize social distancing throughout all of our schools in any way possible. And we're going to do that by modifying schedules. We're going to be very creative. We're going to try to reduce the number of students in some of our spaces. We're going to reduce the chance wherever we can that this virus can be transmitted. And we're going to limit potential exposure in all of the spaces. And this could look like reduced capacity on our buses, reduced capacity in our classrooms, in any large group spaces, reduced and structured movements throughout our buildings, things that we're not used to, but things that we truly believe are necessary to reopen our school buildings. Also, along with this or parallel to this planning, we are working on finalizing a comprehensive plan for fully remote learning for our families. We know that some families, regardless of our plan, are going to choose to keep their child in a virtual option. We understand that and we respect that. However, we also believe that our programs taught by our teachers are what's best for our students. So that is the program that we are developing with our teachers, with our staff. And this academy or this program will be a combination of live instruction, recorded instruction, learning activities, collaborative experiences. It will mirror exactly the Wilson School District's regular instructional program, which is very, very important. It will not look like an outside provider program where it's different. It'll be the same program that we're utilizing within our schools. And we also understand that parents might need to move in and out of this, but we're hopeful that parents also understand that we need some form of a commitment. And we're looking at asking parents to commit to maybe a marking period at a time, maybe a trimester in the elementary schools, to allow us to really customize and build our program so that it's beneficial for our kids and realistic for our staff members to roll out to our families. So some of the initial pieces, some of the high level pieces that Andy, Dr. Hofford will be discussing. Again, as a reminder, the plan is fluid. You're going to continue to hear that. It just really serves as our guardrails that help us keep our planning moving down the road. We can't become so distracted that we're paralyzed by this pandemic. And this plan will help keep us focused on our goal and where we need to go over the next 5 weeks. At the direction of the governor, the Secretary of Health, and our local medical experts, a big piece of our plan will be requiring all students and staff to wear face coverings. And this is, I know it's a strong statement, but it will be a requirement. And we will work with families. We will help educate families and educate our children on the proper ways to do this. But will be a firm expectation, because we believe through everything that we've read and everything we've been taught that the mask is one of the biggest pieces that we're in control over in slowing the spread of COVID throughout our community. So we want to make sure our families understand that will be an expectation. We're going to obviously have to worry about our transportation system, and part of that survey questionnaire that you're going to receive as a family member next week will speak to this. We need to use our buses at a lower capacity, and we're going to ask our families if they can get their children to work, or to school rather, to partner with us in doing so. That will allow us to transport those children who are not able to get here through other means. We're looking at creative ways to run the buses and to have family members sit together on buses where possible. Another key part to our plan is going to be the screening of COVID symptoms with our staff members and our students on a daily basis. And Dr. Hoffert will go into this in detail, but we're also going to ask our families and recommend that our families pre-screen students prior to coming to school. So it's a double, kind of a double line of defense to ensure not only your child's safety, but also the safety of everyone in our school buildings. And we're confident that our families will do that with us. There's going to be specific protocols hopefully released by medical professionals, the CDC and or the Department of Health in the next few days or coming weeks, with the protocols regarding sequestering students or staff who may be exhibiting COVID-19 symptoms. And we will be working with our team of nurses to make sure that we implement them with fidelity. There will be additional precautions anywhere possible with regards to increasing social distancing in classrooms, reduction of class sizes, common spaces. All of those things are being discussed. And then protocols, procedures, and education for our kids and our staff with regard to hygiene practices. We're a school. The core tenet of what we do is educate children and families, and that can't be lost in this work that we're doing. And we believe it's essential not only to train and to teach our kids, but to provide time in the day for them to ensure that they're following through with these practices. At this point, I would like to turn it over to Dr. Andy Hoffert, who will be reviewing with everyone our health and safety plan.
Thank you, Dr. Trickett. Yeah, as you can see, the health and safety plan is broken down into 4 areas for consideration. And I'll go through kind of a summary of each one of these areas and provide a little bit more detail about what all went into the discussion of those parts of the plan. It's important to know that as part of the planning process, the state asked us to not only complete the template as we intend to open school, but also to consider a more restrictive environment as well. So in the full plan itself, you'll see a column of recommendations for what we're considering to be a green environment, a green status for our area, and then also a column for yellow that indicates some additional changes that might be a little more restrictive. Most of the things, or not, if not all of the things that we'll be talking about tonight, are things that fall within that green column. And then, if we come to a situation where we do need to be a little bit more restrictive with our plan, we can always shift over to that yellow version or that yellow column that we're calling it, which will create some built-in flexibility for our team to make that determination based on the local conditions and local recommendations. So again, the 4 areas that we'll be discussing as kind of our overall guide rails, as we're calling them, are the cleaning, sanitizing, disinfecting, and ventilation, social distancing and other safety protocols. That's the big category where we talk about what our student experience is going to be like within the building. Monitoring student and staff health. Dr. Trickett just mentioned earlier about pre-screening and screening students on the way into the building. I'll talk more about what that looks like. And then just some other considerations for staff and students in order to keep them safe as they move throughout the buildings. So in the first section, again, this is just a summary statement that's taken right out of the report, but our goal is to increase the frequency of our cleaning routines, to increase the number of, or the times that we do deep cleaning within some of our common areas at our restrooms. We're going to be having custodial staff moving through the buildings on a frequent basis, ongoing throughout the school day, wiping down high touch areas. Our district vehicles, our kitchen areas will be undergoing increased cleaning and sanitization routines. We're going to be working with our facilities staff to try and increase our airflow with our HVAC systems and increase the rate at which we change our filters out. Our facilities team has actually already begun working to bring in some additional supplies and equipment in order to make this possible. They've already begun training on cleaning practices that are approved for COVID-19 and responding to that virus. And we continue to develop our procedures in this area to ensure that our buildings are as clean as possible throughout the day, and that we're disinfecting as much as possible throughout the day and afterwards. So our custodial staff schedules may be adjusted to ensure that we have the staffing needed in our buildings at all times to accomplish this. When it comes to social distancing and some of the other safety protocols, again, this is where we begin to discuss what our student day looks like. And a large part of this is trying to reduce the number of students in our buildings at any one time, and to help them continue to maintain that social or physical distancing within the classrooms. Dr. Stout and Dr. Trickett are going to talk in more detail about what that might look like at both the elementary and the secondary level. But it includes trying to reduce class sizes as much as possible, reduce transitions between classes, provide more of a cohort model so that students, if they are moving together and staying together as a group rather than intermingling between classes. At the secondary level, looking at ways to reduce the total census, the number of students in our building at any one time. And we'll talk more about what a full schedule plan might look like between the elementary and the secondary. And I can tell you at the elementary level, we're looking at the option of bringing back students in grades K through 6. And again, Dr. Stout and Dr. Trickett will talk more about that. But what does that look like, bringing back all of those students into our buildings? How are we reducing class sizes, reducing transitions, as I mentioned, and ensuring that our students are able to maintain physical distancing in our buildings? And we've done a lot of work to see if that's even feasible. At the secondary level, we are looking at a modified schedule, a hybrid model, where we would reduce the number of students in our secondary buildings, grades 7 through 12, in half in order to provide lower class sizes, vastly reduced class sizes, and also to provide fewer students in our physical environments in our large spaces in order to accommodate that social distancing. And again, Dr. Trickett will go into more detail about what that looks like in those areas. Transportation, again, trying to reduce the number of students and the number of students we're transporting throughout the day. And again, through all these options, you'll see over and over again that we are intent on providing a full virtual option, a robust virtual option for any of our students who self-select that and require that type of instruction going forward. When it comes to monitoring student and staff health, our nursing team has been working on creating some additional protocols and practices that they can utilize throughout the school day when it comes to trying to isolate students, protecting not only the students who could be infected that we find during the school day, but then also pre-screening students upon arrival. So we're going to be working with our families, pushing out some information about symptoms to look for, how to screen for a temperature, and the conditions under which they should probably keep a student home. At the same time, when students arrive for the school day, our plan is to be screening them for temperature. We have some thermal cameras we'll be using at all the building levels, in addition to some handheld touchless thermometers and our additional nursing staff for arrival, where we'll be able to screen students on their way in, and then isolate students who may be exhibiting a higher temperature to do some additional screening and to determine if that's a student who might need to be sent home. So we are working very closely with the Department of Health and waiting for some additional guidelines for CDC when it comes to protocols regarding return to school and what to do in the situation of a student who is found to be positive or may have had exposure. And those protocols will be put in place, again, as soon as we receive some specific guidance from those agencies. And again, our nurses have been working directly with us, in addition to our consultants from the local medical community, to expand upon some of these practices and procedures that are in much more detail in the full report. And the final section of the plan really highlights just what they're calling some other considerations, but really it talks about this requirement for masking. What we've heard over and over again is that the number one thing that's going to help reduce the spread of the disease is for everyone, students and staff, to be wearing face coverings as much as possible throughout the day. Again, Dr. Stout and Dr. Trickett will go into more specifics about what that might look like in the classroom environment. And of course, we understand that younger students are going to have much more difficulty with that throughout the day than older students. We have students who have medical concerns that we'll have to take into consideration and communicate with families about. But we can't stress enough how important our medical community has stressed that that masking is one of the most important things that we can do in order to prevent the spread of the disease. Again, I'll reiterate again, our full virtual option will be available for any families who select that as their option. And we're working to finalize a plan to make that as robust and meaningful as possible for our students. Our next steps as a group are really to break out into a network of subcommittees. And as I mentioned before, this is really just the plan we're working on tonight is really just the starting point. It's the guardrails that all of our subcommittees will be using to guide their work and to guide their roadmap of questions that they have that they're working through. You can see there are a list of subcommittees that are headed by some different leadership in our district. And each of these subcommittees include members from our teaching, faculty, administrative staff. And they're working through basically the nuts and bolts. What does this look like? How is this going to be implemented on a practical level when we come to our buildings in the fall? And that's work that will continue to change and progress as we get closer and closer to the start of school year. So the work really has just begun. The plan that we're bringing forward tonight, like I said, is our starting point, but it's going to be kind of foundational in the work that the rest of our subcommittees are doing. At this point, I'm going to turn it over to Dr. Stout to talk about the elementary experience.
Thanks so much, Dr. Hoffert. As you've heard multiple times now, this health and safety plan really is the framework or the guide rails that we will be driving between. Please know that in order to achieve a comprehensive implementation of our plans to reopen, we are going to engage those subcommittee members as well as our professional staff, as well as our leadership, members of our community. So we do have many more decisions to make about the logistics and the implementation pieces. And we know there's a tremendous complexity to all of that. So what you're seeing in front of you right now is a presumptive green phase of what elementary will look like if we're returning to school in green at the beginning of this year. So all kindergarten through 6th grade students are going to attend school face-to-face with this particular plan. Students in K through 5 will be beginning the year in a staggered model. And what that means is very much like our kindergartners have done for several years now, each of the grade levels K through 5 will be approaching the start of the year in a 1/3 sized group. So 1/3 will start on the first day, 1/3 of students will start on the second day, 1/3 of students will start on the third day, and then on the fourth day, all students will join their rostered classmates. And the reason we chose to do this is because we believe that it's very important that we take into consideration what we know about trauma-informed practice in education. And we know that this has been a really traumatic time for families and for children. And so when we're thinking about the emotional wellness of our kids, we want to make sure that we're addressing those needs and perhaps relationship building needs in a small group format. So we're thinking about this 1/3, 1/3, 1/3 as a way to really reduce the size of the group that will be introduced to this new model of education for the first few days of school prior to rejoining their entire rostered class. That will give teachers time to help them learn procedures and protocols, safety processes, as well as for teachers to get a handle on where these children are emotionally with their reentry to school. We may be looking at some variation in start and end times somewhat so that we can make that accommodation to run our buses at 50% capacity. So we'll be talking about how we could potentially adjust in some ways to provide that ability with our busing. We're looking to reduce class sizes so that we can ensure proper social distancing. We want to minimize the number of students and have them in a cohort model across the day to reduce this cross contact with other students and the commingling. So what we're thinking about is having a classroom of a maximum of 22 students. And if you take a look at this next slide with some photographs, I was able to actually go in and set up a classroom so that you can see one of our smaller classrooms, and this is a grade level classroom, not a supplemental instruction classroom, a grade level classroom where the desks were able to be social distanced and follow all the guidelines of this physical distancing and the other recommendations that have come from the Department of Health and the CDC and our local health professionals. In this model, we're able to accommodate 22 desks for students. We would like to reduce that number even more so if we're able, and that's going to depend upon the results and the data that comes back from our questionnaire, asking our families what their intentions are. Will they be sending students back for in-person instruction, or will they be choosing the in-person, or excuse me, online virtual option? So once we have that data, we'll know some more about our class sizes, but you can notice here there is distancing space for the teacher to operate at the front of the classroom. And the next slide also shows you both a schematic with the actual measurements, as well as the distancing indicated by the tape measure from mid-desk to mid-desk is a minimum 6 feet. And then we know that students sit behind the desk, so that gives us an additional space for which we can achieve that physical distancing option. And then some of the other pieces you've heard mentioned many times, we'll be asking students to wear masks across the school day, as well as our staff members. We do know that there is developmental appropriateness to be taken into consideration here. What masking looks like in kindergarten will be vastly different than what it would look like in the upper elementary grades. We intend to have students be able to take breaks when they're able to be social distanced. So times that they're sitting at their desk, or when they are at least 6 feet apart from other students, they will be able to remove their masks for a period of time. However, based on recommendations from our local professional physicians, masks will be worn for any transition. So if students leave their desks, they're using the bathroom, traveling in the hallways, and so on, we will be asking them to be masking at that particular time. They're also going to be participating in those hygiene routines. They'll be washing hands across the day multiple times, especially when they're eating snack or eating lunch, using the bathroom. We are in conversation with our nurses about the appropriateness of the students being able to potentially use a Clorox wipe to clean up their personal learning spaces, particularly after eating. We know that according to this particular plan, students will likely receive their meals in the classroom. We don't believe that the social distancing options in the cafeteria are adequate. And so we want to make sure that, again, students remain with their cohort. In addition to that, mealtime, students will have recesses twice a day, and we'll try to optimize the use of outdoor space when the weather permits, so that they can get a lot of activity and breathe the fresh, clean air. And just please rest assured that students will also have access to a full program in-person instruction, which includes the core content areas they've always experienced in school, as well as access to their special classes like art, PE, discovery, library, and music, even if those are modified a little bit and we have potential opportunities for maybe specialists to come to students. So these are the plans that we have in place for now. Keep in mind, this is the plan if we're looking at entry and reopening within the green phase. We are in the development of a potential hybrid model for elementary school, but again, many complexities to a hybrid with younger children. And then of course, also finalizing some plans for the fully online virtual model of education. So should the governor or the Department of Health make a statement that our schools are closed and that would need to be an option for all students. So at this time, we're ready to hear from Dr. Trickett to continue on the conversation about middle school and high school.
Thank you. As Dr. Stout said, there are unique challenges with our younger children when you look at different options for learning programs. Couple that with the data that we received and the guidance from the medical team around the ability or the probability that younger children contract the virus and are able to spread the virus. We have made a recommendation to our board tonight and to our community to keep our 6th grade students in the same model as our K-5 students. Obviously, it would have been easy to just cut the line at the 5th grade mark because that's where our schools end. But again, based on the age of the children that we have in 6th grade and the ability to spread students out and to reduce class sizes, that will maximize social distancing, and our ability to cohort students together, just like they do in an elementary school, we feel comfortable that we can propose the same model for our 6th grade students. So again, for the middle school parents that are out there, the way that this would look different from a regular middle school schedule is that the group that your child is with in first period, if let's call that English, would be the same group that child would be with throughout the school day. They will go to their different classes. They transition of students throughout the building. If that's something that our team feels is capable of producing and doing safely, would be done with that cohort group. They would be done on an alternating bell schedule so that they would be the only students in the hall at that time. Again, this meets our criteria or goals of social distancing, reducing our class sizes, and reducing the cross contact wherever possible. Lots of things to work out with our food service, and you see that we have an entire committee dedicating to food service. Our new director of food service is very capable and is working with a great team to developing our plans, because this is a moving target based on where the guidelines are with the size of the gatherings that we're permitted to have. That second bullet point will change. We're also looking at creating schedules for recess, having access to the same specials that any 6th grade child would have, and being outside as much as we possibly can, giving students the opportunity just to be outside with their peers and to get those masks off wherever possible. We're also looking at the secondary level at adjusting start and end times, possibly to the school day. Part of this is with busing, but part of this is with our ability to onboard kids into our school setting. We have a lot of students in our secondary buildings, and as we all know from parent drop-off, sometimes that can be a hectic time. So if we can reduce that, or if we can come up with a system to make that easier for our teams to manage, we think that this is the best time to do that. So more information will be coming as our committees finalize their work. In our 7th to 12th grade school setting, we have a lot of challenges. And for those that are on the call here, the best way I can describe a secondary schedule is to liken it to a college schedule, where you go into your first class on a Monday and you're with a certain group of students. It might be 30 students here at the high school. You may not see any of those students the rest of your day in all of the other classes, even though they're in 9th grade with you. Our schedules are exceptionally personalized, and we pride ourselves as a team in the high school of really being able to deliver on student choice. That is very hard to do with 2,100 kids in a building. And we've wrestled with this. We've gone back and forth with our secondary model. And our best thinking right now in secondary is to try to reduce the number of kids in our classes in our school by half. That's it. A number that we feel is manageable. It's a number that we feel that we can deliver on all of those target areas that we discussed previously. And the way that we're looking at doing this in the middle school in grades 7 and 8 is to utilize that teaming approach. Take that concept of teaming and build it again as a cohort model, where those kids would stay with their peer group in period 1 as much as possible throughout the day, limiting transitions, limiting the number of children in the hallways to the greatest extent possible to reduce the amount of students that they come in contact with. Also, by reducing half of our population by using an A-B rotation, which I will explain to you, we'll have about half of the kids on any given day in school. So in a class of 32 kids, that would be a very large class in our high school. The most that we would have in that building, in that classroom, is 16, plus a teacher, possibly an additional aide, a support person in there for the kids, which keeps us within our guidelines for social distancing. Obviously, this will minimize and reduce the number of students and faculty in our hall at any given time, which will allow us to create some additional protocols to actually work on the flow of children and students throughout our school buildings. Again, you see the same bullet point there with regards to cafeterias and meals and coming up with appropriate places for students to eat. Flexibility is going to be key. As we get to our older level students in our school, we can be very flexible with those students. More often than not, they meet our expectations and prove that they can handle more responsibility. So this will be a year where we'll be putting some more responsibility on them and giving them some additional freedom to allow us to even open our school further. And some of our senior parents that are on now already received a survey about some options that you would have. None of those pieces are required, but we are recommending to loosen up some of our graduation requirements to allow our senior students a little bit more flexibility in their day. The next slide talks and shows visually what the A-B rotation would look like. So for sake of this conversation, Group A under face-to-face on Monday would be half of our students in secondary grades 12 or 7 to 12. So half of our students would come to school as they normally do, ride the bus, walk to school, get dropped off, or drive in their car to the high school. While the other half of students are at home, participating in learning in their home environment, not in school in this particular model. On Tuesday, those two groups simply just switch. So Group B, that was doing their remote learning, is now in school face-to-face with their peers and their teacher. And Group A is at home. The way we've described this type of a learning is a chunk. It's a 2-day lesson plan. And we have full confidence in our professional educators that they can design meaningful and impactful learning experiences for kids during both of those days, whether they're here face-to-face or whether they're home working collaboratively with their peers. I'm going to skip Wednesday and I'm going to jump to Thursday and Friday. Thursday and Friday, you see, is the exact same model as Monday and Tuesday. So Group A is on Thursday, Group B is on Friday. So again, Group A would be in school face-to-face on Monday and Thursday. Group B would be in school on Tuesday and Friday. On Wednesday, we're proposing a live synchronous learning environment where all students will be home. And there's some caveats to the all students. But students would be at home. They would be participating in live synchronous learning experiences, similar to what we're doing right now. The teacher would be teaching. Students would be going into breakout rooms, collaborating, working on content, working on learning activities. The teacher would be checking progress from the day before, again, in that live setting. This would be an opportunity for all 32 of those kids to participate as a class to build that sense of community that will be a challenge in a hybrid model. This also gives us the opportunity to do some additional deep cleaning, to do some additional safety protocols within our building with a reduced student count in our schools on that midday, in the midday of the week. Obviously, there's going to be exceptions to that. We're looking and working with our special education teachers, our supervisors, and our team of principals to identify students who would benefit from a 5-day-a-week model. And we are preparing to release those recommendations where we can to make sure that we're meeting the specific needs that each child has with their learning goals. Also, we understand that our families, depending on how we decide to break up this AB structure, that we could possibly split some families up. And we are committed to keeping family members who live in the same household together wherever that is recommended. If families would request that, we are committed to coming up with a plan to ensure that can happen for childcare, for just ease of the family unit at home. So again, just a little bit of the reminders or a recap from this presentation. I know it was a lot of information. We want to just draw attention back on the fact that we want to be able to provide in-person instruction full-time to our students. That's our plan. That's our desire, and that's what we're trying to do. We believe in working with our team that's starting in a blended or hybrid option at the middle school and high school, and small classes in the elementary level will set us up for success and allow us to ensure that we can keep this system going as long as possible. While this is happening, we'll be monitoring the community spread. We'll be monitoring what's going on, in our local medical facilities. We'll be evaluating our plan constantly through this process, and obviously taking the guidance from the governor and the Department of Health. If we move into yellow, if we move into red, some of these things may be out of our control, but that is our commitment to our community throughout this process. We designed it to be flexible. We designed it to be fluid. And we also designed it to allow our students and our staff to move in and out of the different modes of instruction that we have to the greatest extent possible. We're committed to continuing to collaborate with our local health providers and to stay up to date on all of the current information and best practices that we have, what other school districts around the nation are doing to respond to the situation that we're in, and also just to communicate with you as a community, as a board, frequently. Ongoing communication is going to help get us through this, and the partnership that we've referred to many times throughout this presentation. So thank you very much, and this concludes our formal presentation. I will throw it back over to Dr. Faley to wrap up.
Thank you, team. As you've heard this evening, the premise of our plan is to ensure the safety of our students and staff to the maximum extent possible. It's also to keep our students in school, in front of the teachers that make a difference in their lives to the maximum extent possible, and for the longest period of time that we can, in the event that the numbers and the virus escalates once again, and we are given directives from the state government on limitations that we can provide within our schools. I was participating in a national group discussion with a group of superintendents in an organization called Transformational Leadership. And what became very clear to me is that everyone across the United States is struggling with the same issues. How do you appropriately physically distance students? How do you ensure that our schools are clean? How do we ensure that we are prepared to provide parents with opportunities to have choice in their child's education? And I believe that the plan that we are proposing this evening hits on all of those pieces and is very consistent with some of the highest performing school systems in the nation. I will also add that in my conversation with the 17 other superintendents, the county commissioners, multiple legislators at the state level, all of us are focused on the same thing: to mitigate the spread of this virus, to keep people safe, and to do so in a way that makes logical sense. Again, giving people flexibility and choice in what they do for their own families. So with that said, I conclude our presentation. I thank my team, the professional staff, the Wilson Education Association, our parents, our medical consultants, our school nurses, the entire team of individuals that's been working on this plan for the better part of 6 weeks to present this information to you tonight. There's much more work to be done in those subcommittees. And I'm very proud of our school district. I feel very blessed to lead this organization because we are doing what's right for students, we are doing what's right for staff, and we are doing what's right for our community. And we are listening to the voices and providing an inclusive environment for individuals to provide input into our plan. And we will continue to do so. So thank you very much, President Hart, for the opportunity to share our presentation this evening. That concludes this portion of our agenda.